We're going to start with the Conservatives with Ms. Goodridge. Ms. Goodridge, welcome back. It's good to see you.
Thank you.
You have the floor for the next 6 minutes.
Wonderful. I appreciate it, and I want to thank both witnesses for providing testimony here today. And I'm going to start out with Dr. Humphreys. I really appreciated how your entire report from the Stanford Lancet, and I'm going to pull one quote. At the same time, evidence clearly shows the folly of assuming the population health inherently improves when healthcare systems provide as many opioids as possible with as few regulatory constraints as possible. Policies that should attract skepticism include the dispensing of hydromorphone from vending machines and prescribing a range of potent opioids and other drugs, i.e. benzodiazepines and stimulants, to individuals with OUD in hopes of creating a safe, addictive drug supply and eliminating the supervision of methadone patients, i.e. converting the system to unmonitored long-term prescription on a take-home basis. I was wondering if you could expand on that a little bit, because I think this is so much the crux of the issue we're in.
So the Commission is very positive about medication-focused treatments, where people are monitored and supported, as I mentioned, methadone maintenance clinics and other opioid agonist therapies. At the same time, the Commission looked at the history of what happened in both our countries around widespread prescription of opioids given with very little supervision in the community. We were assured by the companies and by doctors that no harm would result. Prescriptions went up dramatically, and that is how this whole crisis started. So to say that now, for some reason, now if we distribute opioids without any supervision, that same thing won't happen again, really beggars belief. That contradicts our very recent historical experience, both in Canada and the United States. So we didn't recommend doing the same thing as before and expecting a different result.
And I think that that's an important piece to say, and like the entire idea where so much of where this opioid epidemic started was in fact from the OxyContin in the 90s, 2000s. And so the whole piece around diversion and the increase of 400% increase in prescription opioids. And so my question to you is, what do you think that we could do better or differently? And you kind of touched on the Alberta model, and I'm wondering if you can explain why you think Alberta is doing it right. I agree with you. I think Alberta is doing it wonderfully. I'm very proud of my province for taking this leadership, but I'm just wondering if you could give some descriptions from a medical perspective as to why Alberta is leading in this.
So Alberta has made a major fiscal commitment to treatment of all sorts. They have, extensive opioid agonist therapy. They have residential rehabilitation. They also, by the way, have very strong investments in harm reduction. What they're doing that is different from a lot of other places around the country, my country too, is first off, it is a system. All the parts are integrated together. There's a province-wide plan. There are steps of care that people go through so they can go on a pathway to come out at the end much better off than they went in. And the second thing, as I mentioned, is this optimistic idea of recovery. So, because addiction is a stigmatized condition, there are a number of people who would believe, colloquially and, in say in a cold way, well, once an addict, always an addict, they'll never change, they can't get better. And the Albertan model believes, no, that is not true, that in fact people can recover. We have millions and millions of people who have recovered, who are productive citizens, who are connected to their families, who are people we prize and cherish in the community. And setting that as the goal, as the aspiration, is extremely important, rather than saying we're just going to manage this population and we don't really expect much out of them, and at most we might be able to help them live till tomorrow, and that's all they can ever achieve. That becomes a self-fulfilling prophecy. And so I admire the fact that, when I've gone up to Alberta and visited, seeing what they're doing, that vision that every single person is capable of having a much better life through recovery than they have right now.
And you touched on it very briefly in your opening statement about how you were one of the policy drug advisors for both Presidents Bush and Obama. So you've crossed party lines when it comes to policy piece. I'm just wondering, what did you learn in those roles that you think Canada could and should adopt?
Yeah, I did do that. I'm not a politician. I'm a policy advisor. So since the science stays the science, anyone who wants to adapt it, you can work with a broad range of people, and that's what I've tried to do. What I saw in both of those administrations was the commitment to treating addiction as a health problem was profound and important. Both those presidents, although they differed in many, many ways, obviously, they both believed this is something we could handle addiction through the healthcare system. Yes, we need law enforcement when someone, does something violent or because of their addiction. But for the most part, we want people to be able to talk to their doctors about their addiction like they would talk to them about cancer or like they would talk to them about a heart problem. And they both moved our system that way. And Canada, by the way, does better than the U.S. It gives health insurance to everyone, and I think that's great. We moved some progress towards you, and that's something we, would like to copy you in. But I think that concept, try to manage addiction as much as possible in healthcare. You don't need the public safety unless the person does something that threatens another human being.
Well, thank you. We agree completely from our perspective, at least on the conservative benches, that addiction is a healthcare issue and it needs to be treated as healthcare in order to move forward in destigmatizing those conversations so that people can actually have those conversations with their doctor and get the treatments they need in an appropriate manner is absolutely required. So I just want to thank you for your leadership on this and thank you for being part of this committee. And if you have anything further that you'd like to add,